BBC, inspiring Uganda.
Welcome to Chirudu National Referral Hospital, and this is our ICU. Our ICU was developed and started in 2021 in response to the COVID-19 epidemic, and we started originally with 3 beds. We started as a 3-bed ICU, but as we could not fulfill the needs for the entire hospital and for the country, the ICU was expanded to accommodate approximately 9 beds. We usually manage patients who have respiratory failure. That's patients who are unable to breathe on their own. We're able to place them on our machines known as the ventilators, and we're able to give them support. We're also able to give critical patients critical care in terms of advanced life support and such. We also receive patients from around the country who have a number of issues such as kidney issues, who we are able to help with dialysis and other support as well. Currently we have a capacity of 9 beds. We do try to improve, and we do try to build our capacity to have more patients.
A very good morning to you. Thank you for joining us on the Health Q&A. My name is Sophia Matovu. We do come to you every Wednesday at about this time, and it's a time for you to participate. Midway the show, we do share the WhatsApp line, of which you can be able to discuss with the experts and ask them what you want. Now, across Uganda and the region, more people are being diagnosed with cancer, and it's a fact. Now, cancer treatment services and specialized care are available at Uganda Cancer Institute. However, there are questions. Are the services accessible and affordable? That is what most people are not sure about. Some people will shy away from going there because they think, it costs an arm and a leg, or they actually do not know what does happen there, and they are not willing to even go an extra mile to discover. Now with me in studio is Dr. Henry Dungu, the head of Department Clinical Oncology at Uganda Cancer Institute. He's going to unpackage the realities of cancer treatment for us this morning. Good morning, Dr. Dungu.
Good morning, Sophie.
Good to have you on set after a long time.
Wow, it's been such a long time.
Yeah, true. Now, Dr. Dungu, I would like you to start by sharing with us, on an average day, or generally, or annually, or monthly, how many cancer patients does the Cancer Institute receive?
Well, thank you so much for that. As you know, Uganda Cancer Institute has been in existence since 1967, initially established as a center for treating childhood cancers, particularly Burkitt's lymphoma. That's when it was formed. And it was an initiative between Uganda Mulago Hospital, Makerere University, and the National Cancer Institute in the US. To cut the story short, it has turned out to be now an institution that is established by an act of parliament as an institute to take over nationwide mandate for cancer care in the country. Previously we had fewer numbers compared to how we have, but I can tell you that, for instance, last year I think we got over 8,000 new cancer patients. And this is an escalation because, it used to be less than that. I remember, like in maybe 3-4 years ago, would have maybe 3,000 new cases. We got 4,000, but now we went up to 8,000, maybe 700. All that in 1 year. And I'm talking about new people, not those who have attended care. When you have people who are coming in and out, of course the numbers are too many. Just imagine any person who comes in will need to be evaluated on a regular basis. They come in, they get treatment, they come back for review, they get emergencies. So the numbers are quite many, and that makes the Uganda Cancer Institute quite busy. Mm-hmm. When you look at an average, for example, on a particular day, you're going to see both new patients and old patients. And the new patients will go through a process, getting registered. Then after registration, the doctor sees you. They check out to see if you're an emergency or not. If you're an emergency, you're given urgent care. If not an emergency, then you go through the routines of making sure that we have the right diagnosis, we have the supportive investigations that are going to, help us get to know the actual treatment to give you. So various activities take place on a particular day. There are those who come in for just a refill. Someone comes in and they will spend less than an hour. They get a prescription and they go away. So the activities are quite many. But when you look at, for example, a general outpatient clinic, we can see over 500 people in a day. And that's quite a number. Looking at cancer as a unique diagnosis, people just don't walk in the way you say, I need a refill of this kind of medicine. People are unique. People have unique challenges, united all by one diagnosis called cancer. So you cannot say that a particular patient will spend this much, or because I saw you today, I can only see you after 3 months. They're all different. But all in all, the numbers are enormous. The patients are coming in, which is good, because this tells us that much as we say that there's an increase in cancer, but there's also an increase in the awareness. People are now understanding that when you have a problem like this and that, and they tell you have cancer, you can go to the cancer treatment facility and get the necessary treatment.
But still now, why are you seeing more? Why has the number gone that high? Because if you did the comparison of 4 years back, and this number alone is quite alarming, because I imagine, now we haven't yet gone into how many old do you have, we're just looking at the new.
Yeah.
Why do we have a rise in the cancer?
There are quite a number of factors why we have an increase in the number of cases, and this is a global trend. You look at global estimates, and estimates for Uganda, they're almost in line. We expect that as we continue to move on in the years, even more numbers will come. One, we're having an aging population. One of the risk factors for cancer is age. As you grow, a number of things happen. There are environmental factors that can help changes to take place in the system. You get into what we call mutations, and then cancer comes in. But there are also other factors. Almost 50% of the cancers we have in Uganda are infection-related. So many of them are infection. For example, cancer of the uterine cervix is as a result of an infection. Cancer of the liver is as a result of an infection. Certain cancers in the digestive system are because of infections. There are quite a number. Kaposi sarcoma, etc. And the good thing is that much as we are trying to work together to expand immunization against such diseases, we still have those who have not been given the opportunity to get immunized. So those infections are still prevalent. HIV has come down, but for a long time we knew that presence of HIV would increase one's risk of having cancer, especially Kaposi sarcoma and lymphomas and others. There are other factors why we are seeing this. One of them is cancer has been with us for a long time. It's not that it's new, but the awareness. For example, Uganda Cancer Institute has a community program reaching out to different communities to raise awareness, to do community screening. If we could pick whoever is in the community and bring them here to Cancer Institute, there would be too many, because there are quite a number of people with cancer in the communities, but they're not even aware. Someone has had a breast lump for years, and they're saying, after it's not painful, I don't have to bother. By the time they're told to go to hospital, it's too late. But when we go out to the communities and do the screening and do the community diagnostics, it becomes much easier. And people, they lose the fear they have around the diagnosis of cancer. So these factors and a number more are contributing. Now, for example, here we are on TV. UBC is going everywhere, and people are going to get information. So media has helped a lot to sensitize the communities about this condition called cancer. And people now know that if you're diagnosed early and get the right treatment, you're going to be treated and you get cured of the disease.
Now, August, you did talk about how the Cancer Institute started. Do you still see, as a children's center, to deal specifically with Burkitt's lymphoma, how is the rate now? Do you still have many cases of Burkitt's lymphoma years down the road? Or it's one of those rare cancers that you'll get to see, even like Kaposi's sarcoma, given the fact that HIV treatment has been well managed, the drugs are available, you see the interventions from 8 to 1 tablet. Now, a lot is happening in terms of advancement in medicine.
That's a good question. And you know, at some point I was doing a clinical trial on interventions for treating Burkitt's lymphoma. I can tell you the numbers for children could not be met because it has become a rare diagnosis. Burkitt's lymphoma is one of those cancers whose etiology, is around malaria, Epstein-Barr virus infection, and others. Malaria is being controlled. I think the National Malaria Control Program is doing a good job, and we are no longer seeing as many Burkitt's lymphomas as possible as it used to be. Also to note, there was a lot of misclassification in the beginning. People thinking that whoever has a jaw swelling is Burkitt's lymphoma. Indeed, studies were done and actually found that a significant proportion of those were misclassified. Instead of calling them the right diagnosis, they were wrongly called Burkitt's lymphoma. So we have worked on that to ensure that we can now rightly tell what is what. We are not saying every tumor is this. We are now able to go into advancements in cancer diagnostics that we can tell. So Burkitt's lymphoma is not as much as it used to be. In some countries, in some parts of the country, where control of malaria is not as much, they still have Burkitt's lymphoma, but it's not as common as it were. And I suppose if Sir Dennis Burkitt had a chance to come back, he would be surprised to say this was the commonest. It was following the malaria belt in Africa, in the tropics, but now the numbers are getting less.
Okay. Now, of the new cases that you see, or that you saw last year, because talking about the 8,000, what are the most common cancers that are being presented and possibly why?
Okay. So the most common cancers in Uganda, when you look at the different sexes, when it comes to women, the commonest cancer remains cancer of the uterine cervix. And then cancer of the breast. These are really, really common. And in men, prostate cancer is top on the list. Then we have cancers of the digestive system that are very common. Kaposi's sarcoma has always been one of the commonest cancers in men. But again, with the interventions that are taking place, HIV care and control, Kaposi's sarcoma is also reducing. Though it's still available, but it's not as prevalent as it used to be. But still it's on the list of those top common cancers. Then cancers of the blood system like lymphomas are not as common. We have them, but they're not the most prevalent cancers that we have. The challenge with liquid cancers is that they're quite aggressive and their management is quite intense. So much as they may not be as common as cancer of the prostate, but they take a lot of effort and a lot of resources.
What about the new one, the cancer of the esophagus? Is it one of those common cases you also see now? When
I talked about cancers of the digestive system, I wanted to include that. But cancer of the esophagus or the food gullet is a very, very common cancer. And I think we are doing studies to understand exactly why cancer of the stomach or where the food is kept, and then cancer of the large intestine. These are really common cancers. The large intestine up to the end of vag, they are quite common cancers.
So whichever form of cancer, as long as it's in the large intestine up to the esophagus,
so
classified colon, rectal.
Sometimes we say colorectal cancer to mean any cancer that is in the colon up to the rectum. But when you say digestive system cancers, then you are covering the entire digestive tract from the mouth down to the anus.
Okay, then what is the ratio Because the number, for me, the number is still overwhelming. And quite, you know, you're looking at it and you're like, really? So, as in, what's the ratio of doctors per patient? How are you trying to manage? Because I can see some of them need even the nursing care besides just coming in for the treatment, depending on how their condition is.
It ashames to talk about that because it doesn't meet any international standards. Because if one doctor is going to see more than 50 patients in a day, that becomes a big challenge. And you know, as I said earlier, cancer care is unique and is taken care of by unique professionals. A professional who takes on that responsibility of, you know, taking care of cancer patients, I think is gifted by nature. You know, as you speak about Uganda and other being gifted. Not every health worker will take care of cancer patients. It has a lot of emotional attachments. It has a lot of commitment. You find a senior consultant, you know, many times the senior consultant is expected to work maybe a few hours in a day and then they do other work because you consult for the entire country. But you find someone seeing patients for more than 7 hours, okay? So the numbers are way too big than the expertise that we have. When you look at, for example, the number of radiation oncologists in this country, it's quite few compared to how it should be. So I will not tell you what the ratio is, but just know that we have significant, you know, significantly low numbers of health professionals in all categories. You look at the doctors, the nurses, the laboratory people, the technical people in all aspects, biomedical engineers, they're all not meeting up with the expectation. Yeah.
Then what's it like? Because, you know, like now we get to our question of accessibility of the services. It's one thing that everybody feels maybe they might have limitations as to why they might want to come there. And then there's also the scare, naturally, of the minute somebody just told, go and get a biopsy done, it could possibly be cancer. They already feel like they have been sentenced. They don't even want to go through the process.
You know, that's a very good one, and I know we've talked about such things before. Here talking about making a diagnosis. Ladies and gentlemen, you can never make a diagnosis of cancer by just looking. Today, this year's theme for World Cancer Day was United by Unique. We are all united by one diagnosis called cancer. But every patient has a unique story to tell, okay? When you look at, for example, breast cancer, 2 people might have a swelling in the breast. But when you take a sample from each of them, those 2 tumors will be different. And the treatment approach will be different. It's extremely important to have a right diagnosis. And the right diagnosis is made by the right expertise. They will take off a sample in the right way, evaluate it properly, and confirm it. Then they say, okay, you have this. So accessing services at the Uganda Cancer Institute is much easier than you can imagine. We actually have a well-established navigation system because, as you know, the institute is small, people are too many, there's so many, you know, buildings here and there, but we have, when you see someone in an orange, how do you call it, waistcoat, they're navigators, physical navigators. Just stop them and say, hey you, can you help me? I'm looking for this and that. They will show you where to go. So the process is not as complicated as you can think, because when you come in, most people have a referral note. They're referred from other hospitals. You go in to the reception area, they open a file for you, and the process starts. We are an open system. We don't have middle people who say, I'll help you get to Dr. So-and-so. The moment you get someone like that, you just know you're not at the Cancer Institute, or you are having a wrong person. You know, today I was having a group chat with our colleagues, and someone shared a prescription purportedly from Uganda Cancer Institute. And we said, of course, no one can write something like this. We all looked at it and we said, now these are some masqueraders. There are some people who are there to confuse, and they'll tell you that, okay, we will take you through this and this. Please don't accept. Our system is open, our system is clear. It might delay, not because we want to delay, but because of certain, processes that we have to follow. You cannot start on cancer treatment unless we know the actual type. Mm-hmm. You cannot start unless we know the extent of the disease and any other comorbidities one might have. Some medicines are not given to people with heart problems. So we'll make arrangements for you to go and have your heart tested or your hearing tested. By the time you go through all that, it might take a bit of time. And people should be aware that it's not because we want to delay you, but everywhere in the world, that's the routine. Of course, because of a few challenges in accessing certain things and the numbers we have, ours might be longer than it should be. But we are working so hard to make sure that we can access. And also, not everyone can come to Uganda Cancer Institute in Kampala. That's why we are moving out to the regions to improve accessibility. For example, if someone has a cancer diagnosis and they're in the northern part of the country, they don't need to travel to Uganda Cancer Institute in Kampala. There is a Uganda Cancer Institute regional center for northern Uganda, which is in Gulu. So you go to Gulu, it is well established. It has diagnostics, CT scan, X-rays, ultrasound, laboratory, etc., and access to chemotherapy. So people who are from that region at least can be seen from there. And if their condition is found to be in need for referral, then they'll be referred to the main center in Kampala. If you're in the southwestern region of the country, we have a regional center in Mbarara. So people are taken care of from that side, again to improve access. And we still think there are others who need to see us. For example, in eastern Uganda, traveling all the way from maybe Mbale, maybe western side of Kenya, etc., they don't need to come this side. We are setting up a regional center in Mbale, not in Mbale, yeah, in Mbale, yes. Mbale. It's in Mbale, and very soon it will be open. But also we have our friends who are in the West Nile region, Arua, etc. We have a small facility now in Arua, but we are establishing a huge state-of-the-art regional center in Arua, again as a way of trying to make sure that accessibility is improved, to make sure that people get treated as soon as possible. The reason why we get over 80% of our patients presenting in stage 3 and 4 disease is because of logistics of access. If you take it near to them, it will become easier.
Okay. Now, talking about that, who determines, or how do you go about determining that this should be an inpatient and the other should be out? Because some of those, I've noticed a challenge, is most of those who are classified as the outpatients would prefer to still hang around on the corridors in the hospital. They're not willing to go home because they will realize it may be because of affordability on their side. They'll realize that it doesn't make sense for me to go back to, say, Kalangala, and yet I have treatment the following week. So they would rather stay around and wait until when they're done with their course of treatment.
That's actually a big challenge. When they're in the corridors, they're actually not inpatients. They're still outpatients who have nowhere to stay, maybe. And who determines to be an inpatient is the patient's condition. The doctor will see a patient who is unstable. A person who is quite unwell, or a person with acute leukemia who is just starting on treatment, they cannot be treated as outpatients. They are admitted. But those who are not inpatients will be discharged to be coming in from home. So it is a big challenge, because just imagine you have a patient, as you said, coming in from Kalangala, and that to be on daily radiotherapy. Radiotherapy is given in small fractions. For example, they tell you in a week you'll appear for 5 times. If someone is coming in from a faraway place, it will be difficult for them to commute every day. So this is a big challenge for us as the clinical team. And as Uganda Cancer Institute, together with partners, we've tried to put up a system of accommodating those who come from very far, those who cannot find nearby places of residence, to have a care home where people who are from far can be. They are under the patient navigation program, and to qualify to be in a care home, it should be suitable and fit, not like a critically ill person. Critically ill are admitted. Those who are stable but come from far can be kept in a care home. But some people still will remain around the verandas.
Okay, now because our WhatsApp line is displayed, we would like to take this opportunity to start by using this time to start responding to your concerns. Now, good morning, moderator. Thank you for the show. It's Fatina from Masindi. I have been hearing rumors about breast cancer causes, and some people say that sucking of the breast by the opposite sex reduces chances of being diagnosed by breast cancer. Please help us to know how true is this statement. That's
Fatina. But that statement is not true. But for a lady who has had a baby, there's evidence to show that breastfeeding, by having your baby suckle on the breast, it reduces the risk of breast cancer. And that's why we encourage mothers to ensure that there is routine breastfeeding. There's evidence to show that it can reduce the risk of breast cancer. It's not the other way around.
Now then, this one didn't mention where they are communicating from. Please, why don't you put up signposts on roads or in communities to make people aware of diseases like the way the government did on HIV enforcement, you know? And she says, every day people are cooking in Bovera, yeah? And that is the concern. Then this one says, breast itching like a pepper injection. What could this infection be, please? I need your help. I live in Chengera, Nabingo.
Okay. We all have a responsibility. You know, I've been talking to people about irrespective use of polythene bags or plastics. We need to take full responsibility. There are times when I speak to people and someone says, if they are bad, why are they on the market? Well, people are still selling alcohol, people are still selling cigarettes, because it's a commercial product. But we know that they can be associated with disease, okay? It has to be, if others cannot, it can start with you. And you say, from today onwards, I'm saying no to cooking in plastic, in Kavera, in this, to putting my Chikomando in Kavera, to putting my this in Kavera. And you can say, you as a provider of this, you know, nutritious meal, that instead of wrapping in Kavera, I'll get a nice wrapping paper that I'll use for my customers. I have seen, you know, in many countries that sell, you know, these fast foods, they don't wrap for you in a Kavera. They put in a nice paper and they cut your wrap and you eat that. So it has to be a collective responsibility, because we know for sure that use of these plastics is associated with diseases, including cancer.
Yeah, true.
And then when someone has breast itching, there are so many people who have allergies that will manifest with you know, breast eczema or something like that. But there are also situations when breast cancer can start as skin irritation of the breast. So if it is something that you have and it's not getting better, it wouldn't be a bad idea for you to be evaluated by a health worker.
Yeah, true.
Because me, where I am now, I have no idea what it is.
Yeah, true. Then this one says, thank you, Dr. Dungu, for your efforts and services to make Uganda very healthy. May God bless you in plenty. That one is called Joshua. Then this one says, hello. My dad has cancer. How is it treated? How is it treated and affordable? This one didn't say. Because if you're saying your dad has cancer, I think it would be good for you to let us know on what specific cancer, because it can't be overall cancer, so doctor can be able to respond to you. Dr. Dungu, thanks a lot for your commitment to humanity. Kindly display your contact or direct me to your hospital. I want to visit you on the issue of low platelets. I have very few, because I know why they are approaching you. By that, he's also a hematologist. He's got many specialties. Then does regular jogging reduce cancer? This is somebody from Nachifoma.
Well, thank you so much for that, and thank you for appreciating. You know, we've been with Sophie talking to the world for some time, talking about how to live healthy and how to, you know, when disease comes in, how to intervene. Regular jogging and other forms of physical activity are one of the ways that we can prevent disease. Whenever we have, you know, obesity and living a sedentary lifestyle, the chance of getting disease, cancer, blood clots, etc. is so high, diabetes is so high. So we encourage people to continue being physically active, to eat healthy, you know, by taking healthy meals, to avoid sugary products, and to avoid alcohol and smoking, to make sure that you live a healthy lifestyle. Eating a lot of fruits. When you have fruits at home, before you sell, give some to your family, they eat, and then say, now we are satisfied, then you start selling. Because fruits and vegetables are very, very good for one's health to prevent disease. There was something else. Someone saying that their father has cancer. Well, you don't have to tell us what cancer it is, but you come to the Cancer Institute. You'll find us there. We actually have a community cancer service program at the Cancer Institute. For those who are not so sure whether they have cancer or whether they need to come for screening, when you come over, it's a nice area. You have nurses, you have doctors, you have counselors who can talk to you and guide you on where to go for, you know, next steps. We've seen quite a number of people who come in for cancer screening, and indeed we notice that they have cancer, and we start on treatment early enough. So you don't hesitate. Come to the Uganda Cancer Institute. If you are in northern Uganda, you can go to Koru in Gulu as you are, you know, entering Gulu city. If you're in Mbarara, you can go to our regional center, the Regional Referral Hospital in Mbarara, and in Arua, you can still go there. But even other regional hospitals now have capacity to do screening for some of these conditions.
Okay. Then this one says, good morning, colleagues. My question is about what are the early signs of cervical cancer and how can it be managed? This is Elvis from Arua. He would like to know. Then you have Bongole. Thank you for bringing Dr. Dungu, a senior, he called you ecologist, but oncologist professional. I am Moses Bongole, Office of the President, RDC Office, Hoima. Do you have regional arrangements for cancer treatment and accessibility of drugs in regional hospitals like Hoima, Masaka, Mbale, and Arua?
Okay. Well, thank you so much for appreciating. We may not have oncology products in the regional hospitals. The fact for this is because, you know, as I said, cancer treatment is super specialized. And even the medicines we use are not the usual medicines. That's why even our procurement system is different. But we work in collaboration with the regional hospitals, regional referral hospitals, to refer the patients to our regional centers. For example, if you are in Hoima, a person can be referred, I don't know if Gulu is nearer to Kampala, whichever it is, you can refer them. And we are working on making sure that at the regional referral hospitals, regional referral centers for oncology or for cancer, we're going to have everything, including radiation. So the plan is to make sure that in Mbarara we have a facility for radiation, in Gulu we have a facility for radiation, in Arua and in Mbale. Because many of the cancers, the part of treatment is radiation, radiation where we use special X-rays to treat patients. And we also want to encourage people. Cancer treatment is not given by anyone. These medicines are not easy. A few days ago, I got a call from a patient who has been with us, but then went somewhere and some person gave him some medicines, and the medicines caused terrible side effects. You know, we have to be careful. You cannot just go to a pharmacy and say, give me this medicine, because I saw my friend is using it.
I will also use the same.
Cancer treatment is not the usual treatment. It can only be prescribed by a person who has expertise in cancer medicines. And even reconstituting the medicine is by special pharmacists. We do it under special conditions. You know, you have a hood that is going to take away the fumes, etc., to ensure safety. So if someone is out there and they're just giving treatment the way they want, it might cause trouble. And that's why we're not putting all these medicines at all the facilities. Yeah.
Then you'd like to respond to the gentleman who asked about the symptom, the signs
of cancer of the cervix.
Yes.
Sometimes I prefer not to say the symptoms, because by the time you get symptoms, it is advanced disease. The best is to go for cancer screening. Cancer of the cervix is one of the cancers that we encourage for women to screen for routinely. Especially, you know, after, now we're talking about those who did not get a chance to be vaccinated against the human papillomavirus when they were young people. If you didn't get that chance, when time comes, go and see your gynecologist, go and see an expert. Sometimes these are midwives who have been trained to do cancer of the cervix screening. You screen to see if there are lesions that can be taken care of right away. By the time you start getting symptoms, such as, you know, bloody discharge, someone is getting bleeding when they're not expected to bleed, someone getting a discharge, sometimes it's foul-smelling discharge. By the time you get those symptoms, you actually have more than stage 3 disease. So do not wait for those symptoms. And I think it shouldn't be a good idea for me to talk about them, because when you wait for the symptoms, it will be too late. You just know that if you are a lady and you have not been screened for cancer of the cervix, find time, go and screen before you get symptoms.
Okay. Good morning from Gulu. Do you have an ICU in Gulu for cancer treatment? What type of cancer is treated there? Then this one goes, okay. Good morning, doctor. Is cancer genetical? My grandfather died of cancer of the colon. That was in 2024. Last week, my mom was diagnosed with the same cancer of the colon, but she refused to go to Cancer Institute due to previous challenges and bad customer care service. That's what he says. Has the service really improved? This is Susan Namayengo.
Well, that's a very good question, and I apologize on behalf of the Institute for the bad experiences. These things happen, and we cannot say, no, it's not true, because, you know, we are a community with so much of culture deviation. Some people may be mishandled. We apologize for that. But we are working so much to make sure that we improve on our care. Actually, when you go to Cancer Institute and you have these phones called smartphones, they are scanning objects you can see. If you need to give feedback, you scan it and give feedback. It is helping us to understand people's challenges so that we can address them. Cancer can have a genetic predisposition. There's some cancers that we know that genes can contribute. It doesn't mean that because your relative had cancer, you'll also have it. But for example, cancer of the prostate, cancer of the breast, some forms of colon cancer can have genetic predisposition. And when you talk about, for example, doing colonoscopies on a regular basis when you reach a certain age, and they find that you have what we call polyps, people with those small growths that form on the inside of the colon could be genetically predisposed to getting cancer. And whenever we find them, we remove, test them, and see if there's cancer in there. If it is, then someone is given the right treatment. Cancer of the ovaries, cancer of, I said breast, there's some certain mutations that we know that can be passed on in families. But it doesn't mean that, oh my God, someone has cancer in my family, I'll get cancer.
Or we even get it from the spouse, like
No,
something.
Oh, cancer is not a condition that is transmitted, you know, like you get an infection. It's a non-communicable disease. Having a relative with cancer, taking care of a person with cancer does not mean that you will get cancer.
True.
So we should give people care and love when they have this condition.
Okay. Good morning. I am Henry from Kayunga. I always hear rumors that people setting polythene bags on fire causes cancer. How far true is this? Then this one says, my father has been receiving cancer treatment at Mulago, but due to lack of money, he cannot come to Mulago. Can he be helped with the medication at Buhinga Referral Hospital?
In Fort Portal?
Yes.
Yeah, as I said again, this is the challenge that we have. I don't know if Buhinga is nearer to Mbarara than to Kampala, because if you can go to Mbarara, you can access. And also it depends on the kind of treatment that we have. So usually what we do is, for people who come from far, and depending on the kind of disease they have, they can be given, you know, delayed appointments. We can give you a supply of medicine to take you for 3 months. I'll give an example. If someone has blood cancer called chronic myeloid leukemia, it's a blood cancer that someone will have for a long time, we can give you a supply of up to 3 months. So you go, you use them properly, and before they get finished, you come back. We assume that in 3 months, you'll have been able to raise funds to come back for review. And then there are those who need close monitoring. Those, we prefer to keep them around, and once we have a well-established hostel, it will even become easier so that they're so close to us. And I think this is a global challenge, because even when you go to other countries, cancer treatment centers are not everywhere.
True.
They're in particular places. Even if you go to, say, the United States, someone might move from one state to another state for a particular kind of cancer treatment. And these cancer facilities have put in place, you know, accommodation facilities. People who move from here to India, you cannot stay in hospital for the entire period of time you are to undergo treatment. So they have residential facilities where they can stay and get their continued care. I wish the same could happen in Uganda, where we have, you know, hostels and affordable accommodation for those who come from very far.
Okay. Then there's this one. Greetings, moderator. This is James from Kampala. Thank you for the program. I'm currently doing some tests suggestive of cancer of the pancreas. Specific CA is 19-9 tests, and results are showing 478 normal range between 0 to 37. But they are telling us to do more tests need to be done. CT scan and more. The patient has no money to continue running these tests. How can one be helped to have tests done and managed at least affordable prices? He says a patient is currently at Mbarara.
Well, those tests, we can actually do them at no cost at the Uganda Cancer Institute. If in Mbarara they cannot, and you have time to come to Kampala, we can do them. CA199 is one of the tumor markers for not only cancer of the pancreas, but quite a number of diseases around there. That's why we don't rely on just one tumor marker to say that you have a diagnosis. The number of conditions that can lead to a rise in such proteins in the body. So if you have challenges, you know, certain cancers, like cancer of the pancreas, need urgent intervention. If you're in Mbarara, speak to our experts in Mbarara, they will know what to do. And through our, you know, tumor board meetings, we have multidisciplinary committee meetings, we'll discuss on the intervention that can be given. But we shouldn't delay.
Okay. Thanks, doctor. I have personally been there since November. Maybe that's at UCI. Till now, my wife is having treatment from there. But the challenge is, as you spoke earlier, that we always report weekly 4 times, but we are getting better and better. The cancer is healable. This is Okech George. The challenge is transport to and fro to, that is to Tororo to Kampala. But I think right now he's under your care, the care of Uganda Cancer Institute, and I'm glad that he's seeing some improvements. Then how will the person, how will the person who has breast cancer be helped to breastfeed her baby? And yet you said it reduces the rate with the baby not also being affected. This is Emma from Arua.
But you know, that's a good one, Emma. If someone already has breast cancer, then breastfeeding won't reduce the risk because you already have the problem, okay? What I was talking about is, you know, for young people who are still getting children, there's a tendency of avoiding breastfeeding. Yet we are encouraging breastfeeding. It has advantages for both the infant and you, the parent. It does family planning, prevents disease, and makes your child, you know, grow up healthy without a number of diseases. But if someone has breast cancer and they are breastfeeding, we encourage them to stop breastfeeding and use other alternatives for taking care of the baby. This is because many times we've started someone on, you know, on treatment, and we don't want treatment to get into the breast milk to the baby. It is also common that a number of people will have the first diagnosis of breast cancer made during pregnancy. That's when they realize, actually, my breast has a problem. And we make a diagnosis, baby comes out, then we start treatment.
Okay. Then this one says, I have Googled and found my problem on low platelets. It falls directly under you. Dr. Christine, as a hematologist, where are you in Mulago? Thanks for the program. God bless you. So this one is definitely, he's at Uganda Cancer Institute.
But Uganda. They're looking for Dr. Christine?
I think even you as well.
Because there's a hematologist called Dr. Christine at Mulago Hospital who can also be seen. So if you have a problem of low platelets, you can actually help. Mulago Hospital, we have a hematology service, and Cancer Institute also has a hematology service. Hematology means blood diseases. And at the Cancer Institute, much as we take on blood diseases that are cancer-related, we also take on complex blood diseases that are non-cancer. A case in point, at the Uganda Cancer Institute, when people with sickle cell disease, when they come in and they have these complications such as stroke, you know, acute chest syndrome, they need a special treatment called apheresis, or what you call changing of blood. That can be done at the Uganda Cancer Institute. So we take on those complex hematology cases. We take on patients with bone marrow failure syndromes, where the bone marrow can no longer make blood, and we treat them. We treat quite a number of other complications at the Cancer Institute. So you can come over, and even if you Google, but you can.
Okay, thank you for the show. What is the difference between leukemia and a lymphoma?
Leukemia is cancer of the blood cells. And leukemia can be for any of the cancer cells, white cells, red cells, or platelets. Leukemia can be acute, and it can be chronic. When it comes to lymphoma, lymphoma is cancer of what we call the lymphatic system. For you to understand the lymphatic system, imagine a day when you had a wound on your toe. People no longer get those because they're wearing shoes. And then the lymph node becomes painful up in the groin. That swollen lymph node, or if you have a sore throat and you get swelling or painful lymph node under the jaw, that swollen, painful lymph node is part of the lymphatic system. So lymphoma affects that system. And we have different kinds of lymphoma. We have, I cannot go through all of them, but there are quite many. And if a person comes in with an enlarged lymph node, we say, could this be TB? If it's not TB, could it be an acute infection that is giving us a lymph node, or is it cancer? We take history, we evaluate, we take physical exam, and if we cannot tell from that, we take off a sample. We take out the lymph node, take it to a special laboratory and evaluate. Lymphomas are confirmed by doing a lymph node biopsy. We take out the entire lymph node, take it for examination, and do special tests on it in addition to the general, what we call H&E, so that we can tell whether this is like a B lymphoma or a T cell lymphoma. When we find it's a B cell lymphoma, we now have what we call target treatment, where we don't give you normal chemotherapy. We call it chemoimmunotherapy, okay? And the chance of cure are like 99% when we make a right diagnosis.
Okay, that's good. Then thank you so much for the educational program on cancer treatment. My uncle suffered from cancer of the esophagus. Unfortunately, he passed on last year. Could you please educate me particularly about this cancer? This person is from Katakwi, but they just would like to know a little bit about cancer of the esophagus.
I think, Sophie, it would be a good idea to invite us and talk more about particular cancers. But cancer of the esophagus is a type that affects, the swallowing pipe or the food gullet. It starts from the back of the mouth and it goes down to the lower gate of that pipe as it enters into the stomach. The cancer usually presents with difficulty in swallowing. Someone realizes that as they're swallowing food, it is hard to go down. It becomes a bit uncomfortable. And you start with solids that are difficult to swallow. Sometimes you add water so that food can go down. Eventually, even food fails to go. And now you're like, food cannot go, let me just take porridge. And if nothing is done, even the porridge will not go, and water tries to go down. And eventually, if again nothing is not done, even your own saliva will fail to go. And that is very bad. So we encourage people, when you have problems swallowing, don't wait for, it can only go when I put food with a glass of water. How come before it was going? Think about it. Before you could eat food and it was going down properly. How come now you have to push it with water? There's a problem. It means the pipe is getting narrower and narrower, that food cannot go through. The best way to tell that one has cancer of the esophagus is by doing a direct observation, by doing what we call an upper GI endoscopy. We have experts who will have a small tube that has a torch and are able to look inside. If they find that there is an abnormal growth in the same sitting, they will take off a small sample and they take it for evaluation, okay? Then they will say, okay, we have found you have cancer of the esophagus. Cancer of the esophagus is best treated when detected early. If you detect it when the length is more than 5 centimeters, it becomes difficult because, remember, you cannot operate properly under the chest. We have people who can do that, but it also depends on the length of the tumor. That's why we encourage people to go early. If you feel uncomfortable and you can access a doctor, go explain to them, then they will do the needful. Don't think that you have ulcers. You say I have ulcers. You know, these days everyone has ulcers.
True.
Eh? Everyone has ulcers.
True.
You ask them, how did you know? They told me I have ulcers. Year 1, year 2, year 3, which ulcers are those?
And they're busy taking off-the-counter
different
drugs.
medicine.
Different.
They got pharmacies, I have ulcer, they give you this. I have ulcer, they give you this. Okay? It's always good to be assured by an expert that what you think is an ulcer is actually an ulcer, and this is how you treat it. And that ulcer is not malignant. By the way, an ulcer means a break in connection of the lining of the mucous membrane. Our inner system is covered by a layer that helps with mobility, with what? Inside there. But if you get a pothole in that connection, that's called an ulcer. And that ulcer can be dangerous, meaning cancerous, or it may not be cancerous. It's only the doctor to tell what it is.
Okay. Now there is this fear, many people are afraid of the biopsy, there is this myth. Bwe bakuggyako akanyama nga cancer atambula. Or if not, so it's like they have tickled the wound and that's it.
Wow. Ladies and gentlemen, we have to take off akanyama. That sampling is done by the experts, and we know which tumors that you don't touch, and we know which tumors that you can easily touch. We have experts. You know, it used to be, for example, if you have something in the abdomen or in the lungs or somewhere, that the only way to get a sample is by doing an operation. But now we can use, you know, closed systems without opening you up to take a biopsy in a safe way that will not lead to spread of the disease. So the implements or the equipment that we use are designed in such a way that they'll pick a sample without spreading it anywhere, without at all. So it is safe, and it is done by experts who have undergone training in how to do these things. Let's not say that, if they take off a biopsy, I'll die. Well, if they don't take off, to know the diagnosis, you might die. But if we make the right diagnosis, we can cure you. Cancer can be cured if detected early and given the right treatment, okay? The right treatment with the right supportive interventions, including palliative care interventions.
Okay. Now, hello, thank you so much for the good program. Now, my dad is having cancer, and we brought him to Mulago for medication. Reaching Mulago, they took him into old CT scan, but the results were not clear by the doctor. So I want to know this old CT and new CT. I don't know what they mean by
old CT. At least for us at the Cancer Institute, we have CT scans that are up to date, not the old systems. And you know, we are lucky that I think government has been extremely supportive to improving cancer care in this country. We can never stop appreciating. Can you imagine, very soon we'll be having a state-of-the-science diagnostic facility called a PET system, okay? People drive to other countries to look for this and that, but very soon the Cancer Institute will be having its own PET and cyclotron system.
Wow.
All this is because of government interest in making sure that people are diagnosed properly and are treated properly. Many of you have not had a chance to visit the Cancer Institute, but for example, when you go to the radiotherapy area, the kind of equipment that we have, I really wonder what makes people travel abroad, because they're even better. The countries I've been to, and they don't have the true beam machines that we have for radiotherapy, but we have them here. But people don't know. People think by going to the neighborhood, you get something better. Unfortunately, it's not true, because you leave good things here, okay? We just have to make sure that we continue to let you know the availability. I remember at some point here on UBC, the permanent secretary was here, and the director of the Uganda Cancer Institute, and they're talking about cancer treatment. And the PS said cancer treatment is expensive. If you go to Cancer Institute and you don't get an invoice, don't imagine that because you didn't pay for it, it is substandard treatment. In the unlikely event that you run out of medicines, and you tell someone, go and look for this medicine, they'll come back and say, doctor, I cannot find this. They say, I cannot find, but they mean, I can't afford it, because it's expensive. But all the medicines we have at the Cancer Institute are free of charge.
Wow.
Government pays for them. And we, how should I say it? We have very high quality medicines. High quality. I'll look for an example of treating multiple myeloma. There's a medicine called bortezomib. And at the Cancer Institute, we have what we call the innovator brands for such medicines, okay? But people don't understand this because they don't get the invoice. And that's why they end up resorting to other alternative treatments where they pay. some money per month or something. And they say, oh, it's after when I took this that I got better. Not knowing that actually the treatment that they received is what helped them. What they're taking is juice. They're just taking normal juice. And someone says, no, this is medicine that does this and that. So I want you to really have faith in the treatment you get. Cancer Institute has the best treatment. Cancer Institute has the best expertise. And we are continuing to build the capacity. We are training our nurses, we are training our doctors, we are training all those who are involved in cancer care to make sure that they have the state of the science knowledge and they're able to treat you properly.
Doctor, you did mention, because remember the other bit for them was the affordability. You have emphasized and said that the medication is for free.
It's for free. If someone says pay for this, that's a lie. I think, how should I even say it? There are times when, as any system, you can get stockouts.
Yeah, true.
You have a delay in clearance, and we try to avoid that. We have a system of knowing that before this medicine runs out, we'll have a supply, so that there's continuity of availability of these medicines. It can happen for a day or two, and sometimes they can tell you, maybe let's have your treatment deferred until next week when the medicines are all available. And then some people say, I want to get it now. But most of the time we have the medicines. And we are treating our patients following cancer treatment guidelines, okay? We don't like the system of, me, I do it like this. Me, I treat it like this. We are working as a system. We have, care pathways that we follow, and our people will know that if say someone has cancer of the prostate, this is where I start. If this doesn't work, then you got this next intervention. But not, me, I do it like this. I think that's not a good system of managing diseases.
Okay, you're still watching the Health Q&A. At this particular time, I'd like us to take a very short commercial break. I can see you have lots of questions coming in. Dr. Dungo is still here with you for our next few minutes, and he'll be in a position to respond to them. It's still the Health Q&A, but right after this very short commercial break.
Welcome to Chiridu National Referral Hospital, and this is our ICU. Our ICU was developed and started in 2021 in response to the COVID-19 epidemic, and we started originally with 3 beds. We started as a 3-bed ICU, but as we could not fulfill the needs for the entire hospital and for the country, the ICU was expanded to accommodate approximately 9 beds. We usually manage patients who have respiratory failure. That's patients who are unable to breathe on their own. We're able to place them on our machines known as the ventilators, and we're able to give them support. We're also able to give critical patients critical care in terms of advanced life support and such. We also receive patients from around the country who have a number of issues such as kidney issues, who are able to help with dialysis and other support as well. Currently we have a capacity of 9 beds. We do try to improve, and we do try to build our capacity to have more patients.
Exercise can't be sustained. Eating can't be stopped. It's even harder to lose weight. Come and give it a try. Genshikang L-carnitine chromium capsules, plant extract, scientific ratio, take 3 capsules each time. The active ingredient accelerates fat burning, eat twice a day, don't take a detour. Weight loss starts now. Genshikang L-carnitine with chromium capsules helps you stay in shape. Please follow medical advice when taking this product. For more information, visit our website www.hgo.com or call 0800 335555.
every Wednesday live in our studios in the heart of Kampala.
We have to change the political culture in this country, really. Who has bewitched Ugandans?
I want to assure you, as government, we shall do whatever it takes to ensure that Ugandans are safe.
We have conversations that have analysis, explanation.
This law society, this union of theirs, because they want a job everywhere, they want to be this, they want to be that, they want... No. We know it's a union.
You cannot be making a road, bitumen grade 1, in Congo for 5 billion.
But not every truth is fact, and not every fact is truth.
The argument that the General Court Martial is responsible for peace and stability is without basis, either in law or in fact.
We have been told how Napoleon was a great orator. Now, Napoleon cannot help me get food. They told me combine harvesters in Saskatchewan. I don't know where Saskatchewan is. This is a geographer we're taught. Instead of teaching me how to preserve Mabera forest, they're teaching me about Rhineland. This is a problem we got. We cannot run away from it.
Right now, you hear very disgusting stories of members of parliament. Instead of discussing the details of loans, they ask for their cuts.
Every Wednesday, 10 p.m. on your public broadcaster.
All on your public broadcaster, UBC, inspiring Uganda.
Welcome to Chirudu National Referral Hospital, and this is our ICU. Our ICU was developed and started in 2021 in response to the COVID-19 epidemic, and we started originally with 3 beds. We started as a 3-bed ICU, but as we could not fulfill the needs for the entire hospital and for the country, the ICU was expanded to accommodate approximately 9 beds. We usually manage patients who have respiratory failure. That's patients who are unable to breathe on their own. We're able to place them on our machines known as the ventilators, and we're able to give them support. We're also able to give critical patients critical care in terms of advanced life support and such. We also receive patients from around the country who have a number of issues such as kidney issues, who we are able to help with dialysis and other support as well. Currently we have a capacity of 9 beds. We do try to improve, and we do try to build our capacity to have more patients.
Welcome back from that short break. We're still on our health Q&A. Somebody was asking me, what does Q&A mean? It's question and answer. Now, we're still talking about cancer treatment, and then are services accessible and affordable? The answer is yes. By now, I'm sure you know. Now, we still continue with your concerns because it's about you. We would like you to participate. We say your health, your say, because you're entitled to your say. Not these things of a doctor just prescribing for you and telling you go and take. You need to ask why they're giving you that particular drug. You might have allergies to the drug. But anyhow, here we go. Now, well done. My husband has swellings below the ear, and it's big. Another one on the, what do you call this, biltold muscle and the medial back. What could that be? This is Maggie from Kumi. Then another one, good morning. Thank you for the program. And they're asking if we could change to Uganda. Okay, now that is complicated. This is Michael from Katakwi. What are the signs and symptoms of cancer? I don't know if all cancers might have one specific symptom that starts, or each cancer presents differently. Dr. Dongo, over to you.
Well, signs of cancer, as you said, different cancers will present differently, but most cancers will present with maybe a swelling. To paint a picture for you, cancer is your cells becoming abnormal. For example, if cells within a lymph gland become abnormal, they'll start piling on each other. They pile on each other until when they form a swelling. So when you have a collection of cells and they form a swelling, we call that a tumor. And most cancers will present as a tumor, as a swelling. For example, if one has cancer of the uterine cervix, around the entrance to the womb, there's going to be a swelling that will start as a flat swelling. The cells continue to grow, and then they become bigger and bigger and bigger. The cells that have become cancerous have certain characteristics that they are not controllable. Under normal circumstances, when cells come, old ones go. When new ones come, old ones go. But here, you've lost the capacity for the cells to recognize that I am old, I need to move and give space to this new cell. So they end up accumulating. And then those that have come in, they become so, weak that they can easily break off and they move to other places and the cancer spreads. So usually there's going to be an abnormal swelling. Someone might present with abnormal discharge, either bleeding or water. Some people present with symptoms of anemia, like feeling so tired when they have leukemia, they're having palpitations, or they're bleeding when they have leukemia. So different cancers will present in a different way. But most solid tumors will present with a swelling, especially if you are able to see. If you're not able to see, some swellings will be inside. For example, in the intestine, you may not see that you have a swelling, but because a swelling is going to narrow down the passage for food to move, a person who used to go to get their bowels regularly, now they start getting constipation. Constipation continues. When they want to go to the bathroom, sometimes they get, like pellets, other times bleeding. Blood comes in because that tumor that is now narrowing the column of the intestine is easy to break off. When you try to force food go through, it breaks off the tumor and bleeding starts. So those are different ways that one can present with cancer.
Then the one whose husband has a swelling below the ears and it's big?
Below the ears might mean anything. It could be a lymph node that is forming below the ears, or it could be another mass. So we have to examine this person. It's important that a doctor takes a look at this, and then we get to understand what it could be, because there's so many swellings that could mean anything. So again, my advice would be that you get to be seen by a doctor and they evaluate and see what it is.
Then this is Richard from Motungo. I was inquiring that my mom, how can my mom be treated? Because she has a swelling in the throat and the swelling turned into wounds. She feels a lot of pain. Can I get an explanation on what is the problem and the best way to treat it? Let's get another question. Doctor, is goiter a form of cancer? Is it treatable in its advanced stage? This is Emmanuel from Fort Portal.
Well, I'll start with goiter. Goiter is a neck swelling. It's when the thyroid gland develops nodules and it becomes very big. Goiter is not cancer, but you can have cancer of the thyroid gland. Okay? When you have nodules in the thyroid gland, we need to make sure that it's not cancer in there. So many times when someone has a goiter or a swollen thyroid gland, they should be seen by both a physician and a surgeon. And we have special surgeons who deal with the thyroid gland to be sure that what we are dealing with is cancer or not cancer. Now for someone with a neck swelling, again, it sounds like this is a swelling that has formed an ulcer because it says it's a wound. Such a wound, it could be cancer, it could be anything, but we need to evaluate. We need to, unless if someone has already taken off a sample and confirmed that indeed it's cancer, you can come into a nearby health facility, a hospital, where they can do a quick evaluation. And if they find that actually this is cancer, then they refer you to the appropriate place.
Okay. Good morning. This is Israel from Tororo. Thanks for the show. My dad was diagnosed with prostate cancer. We haven't yet carried out the CT scan simply because his liver couldn't handle. but he's going through a lot of pain on the waist. He can't walk, can't stand. The main issue is back pain. How is this related to prostate cancer?
Well, thank you so much, and I'm sorry for your parent. Prostate cancer is a very common cancer, and many times it's going to, well, we prefer to have it diagnosed before you get all those symptoms. When you start getting such symptoms, it means it is advancing, because prostate loves bone. It can easily go into the bones and give you pain in the back, pain in the waist, and actually it can have pain as one of the symptoms, but for advanced disease. Bring your parent to hospital. If they say they cannot do CT scan, let it be us to say it, because as we do CT scans and as we do all the other investigations, there's some things that we can do to ensure that someone has good quality of life. We don't wait for investigations to control your symptoms, to control your suffering. We don't like that. It's better to investigate when you're comfortable. So come to hospital, we should be able to take care of you. And I assume that you already have a diagnosis and maybe you have even been to hospital. If there are issues, please come in and we discuss to see how we can intervene.
Okay, so so you have
at
had
the Cancer Institute, we have a clinic that is dedicated to prostate cancer. We have clinics that are for emergency. Like this person could come in as an oncology emergency to our emergency services area, and we'll be able to evaluate and then give them the right direction on further management.
Okay, thank you so much. That's very encouraging. I believe you've heard it. Dr. Dungu has said, take the patient to Uganda Cancer Institute. So sorry about what your dad is going through. Good morning, doctor. I am Flora from Kasese. If I feel a lymph node in my breast and for some months it disappears, is it a sign of cancer?
Well, it may not be a lymph node, but it's a lump, a lump in the breast. Depending on the age, there are quite a number of non-cancerous swelling that can be in a breast. And but we always tell people it is cancer until you prove it's not, because cancer presents with lumps in the breast. For young people, adolescents, and young adults, they can have these lumps that are hormonal. They are rated to the hormone levels, but still we evaluate and make sure it's not disease. If you are an adult and you have a lump, it's not painful, take it to a doctor to have it evaluated. We can do ultrasound scan of the breast to see certain characteristics, and if we need to do an X-ray of the breast, what we call a mammogram, we can do it to give us a better idea of whether this lump is actually showing evidence of disease or not. So you need to be investigated to ascertain what this could be.
Okay. Doctor, you're saying treatment is free of charge, but I see people begging money in town, and they say they are going to get surgery for cancer treatment.
Maybe, there are so many people you find on the streets that are begging for support, and you can never, it's like there are situations where people can have advanced disease conditions and they are referred for further management in other institutions, but not on the streets to start begging for money. Even Mulago Hospital, treatment is free of charge. People need to understand the right ways to get hospital. Of course, there are private hospitals. There are some people who choose to go to private hospitals, and when you go to private, you'll have to pay. But if you go to a government facility, these services are available. Okay? It's because sometimes people don't, I think, trust the system, and they think, oh, when you go to this hospital, you may not get services. It is until when they go there that they say, oh my God, I can't believe this. They were telling me something different, and now what I have is different. Can you imagine? They keep speaking like that, but the entry point was the problem. Someone told them it's difficult to access services at this particular hospital, but the moment they go in, they find it's the other way around.
Okay, and then there's this one. The experience I got in 2023 When my son was diagnosed with leukemia, was very bad. The nurses were very unfriendly. They couldn't get needles for the bone marrow tests, yet the child needed it urgently. They ran tests and the results disappeared. They couldn't give my son even Panadol. Then he's saying that's what he's concerned about.
Oh, that's quite unfortunate. And again, it's a very, very bad experience. We've gone through a lot of such things, and we're trying to make sure that we rectify things. We now have a division that is dedicated to cancer in children and adolescents. And you know, each of these divisions that we have has strategies on how to make sure that they implement the planned activities the way they should be. Everything is budgeted for, and we continue. There's continuous improvement. There is continuous quality improvement in the things that we are doing. And I'm sure, much as you're disappointed, things are changing. So don't lose heart. As it was before is not how it is now. And we hope it's going to get even better. Okay? So we cannot deny that things happened, but we are working on that to make sure that we continue to improve so that our people have good facilities.
Okay.
And also, you know, attitude among health workers. As I said earlier at the beginning, to take care of a cancer patient, you need certain attributes. You need to wear the shoes of the patient or the family member, what we call empathy, so that you understand that what they're going through is not easy. So even when you're tired, sometimes you're like, let me go an extra mile and see if I can help at least one last patient. So, but some people get overwhelmed and they get tired, and you know, but that's a one-on-one basis. And we're trying to make sure that we continue to work with our people. We also want to make sure that we have enough staff so that people don't get burnout. Burnout is a common challenge among health workers, and how they express their burnout is different.
Yeah,
but
true.
By having, you know, a number of people who come into work, someone is given time to rest, another one comes into work, it helps them rejuvenate.
Yeah, very true. Good morning, the moderator and the doctor. Thank you for the show. I have a lot of pain in my lower abdomen up to the stomach. I feel my stomach is full of a lot of gas, and I find it difficult for me to even defecate when I go to the toilet. At times I need to use much force, and I bring out something small or sometimes gas only. This pain is on the lower abdomen and radiates to the left kidney, and I feel it is swollen. Could I be having cancer, or what should I do? Because I have done ultrasound scan and they told me no problem. Yet I have a lot of intestinal pain and abdominal discomfort. Please help.
Well, ultrasound alone may not be the best way, but the way you have given your symptoms, I cannot say that you have cancer or you don't have cancer, but definitely you are suffering. You need to be evaluated. You need to go and see a doctor who will evaluate you further. They might order for maybe more advanced investigations, or even, you know, basic things, but up to the point of where they can find the disease. Bloating and constipation are common when you have a challenge in the routine transfer of food in the digestive system. When you know, digestive products of food accumulates when there's a blockage, of course gases are going to move from it and you start getting bloated. If you have constipation, and as I said earlier, instead of passing normal bowel movements, now you're seeing pellets, it means something is blocked somewhere. Okay, so you need to be evaluated. Sometimes you may need to have a look in by the expert through what we call a colonoscopy. A colonoscopy is, again, a way of looking to the intestines using a small tube that is fairly flexible. It has a torch and it has a video monitor here where they can see what's going on. So they take a look and make sure that everything is good. If the doctor says, we have done ABCD and we are thinking it's good, then ask them, so what else can it be? And the doctor should be able to explain what they have found.
Okay. Then, doctor, thanks for the program. My throat doesn't pain, but an ENT doctor told me that I have acid reflux. Is this another sign of throat cancer? This is Sharon from Gulu.
Well, acid reflux, sometimes we call it GERD, or gastroesophageal reflux disease. It, especially when someone is sleeping or they sleep on a full stomach, acid goes up and it causes irritation. The ENT team are common at seeing such things, but it doesn't mean that you have throat cancer.
Okay. Now, treatment is not free at Mulago Hospital. This one I said hospital. It depends on which sickness you have. This person insists that cancer treatment is not free. They didn't mention who they are, but there we are.
As I said, cancer treatment is not free. It's paid for, and government pays for this. There are situations where people say they're at the cancer treatment center when actually they're somewhere else.
In a private facility?
Yes. At the Cancer Institute, at least the one I know, where we have medicines that are up to 80% of the needed medicines, treatment is free. However, there are situations where maybe another level of treatment might be needed. And when we agree as a team, and the team includes the patient, the family, and the caring team, we can say, okay, now this patient needs, for example, one of the advancements in cancer treatment. Are we able to give it a try? And we discuss, and they say, okay, let's try and look for this medicine. That one can happen. But most of the background medicines, I'll give an example, cancer of the prostate. There's an injection that we give to a patient either every month or every 3 months. And that injection costs more than 1 million shillings. And we have hundreds and hundreds of people coming in every day for that treatment, okay? So you can look at the budgetary projections of such treatment. You have people who are using other forms of treatment, like what we call monoclonal antibodies, where one dose might cost more than 3 million shillings, and they are given to, they get that treatment, and they don't have to pay for it. But people have choices. There are those who choose to go to a private facility, because even when you come to the private services of the Cancer Institute, you still don't pay for the medicines. The money that is paid for is for certain services, but when it comes to medicines, they are all still under the same package.
Okay. Then good morning. I am 43 years old and I have never given birth. But then in my breasts there are those hard things like stones. Is that cancer? Please help. Rita from Lira.
Rita, thank you for this. Lira is near Gulu or Kampala? Okay, whichever. You need to have an evaluation. It's not normal to have lumps in your breast, especially at the age of 43. And especially that, you said you have not had children yet. It's good to go and be evaluated, and we see what those lumps could be. And you don't have to come to the Cancer Institute straight away. You can go to Lira Regional Referral Hospital. They can evaluate you. You can go to another facility that has very good diagnostics, and then they see to see how we can intervene.
Okay. Hello, good morning. I am currently getting treatment at Uganda Cancer Institute. But doctor is saying, okay, this person I think we got. Okay, no. Doctor is saying free treatment is true and not true. I am on a 3rd cycle of chemo, and I've always paid for most of the medicine they prescribe. It's never there in the pharmacy. The scan is also for paying and very costly. Kwegamba. And about the rude nonsense, it's 100% true.
It's 100% true. Well, we are going to continue working on our attitudes to make sure that we are not rude. And also, I also encourage patients to be kind to the caring team. There are some patients who are also not as kind as they should be. Okay, they think everything should be done to them whenever they want, at any moment they want. But that doesn't give us, leeway to be rude. These are our customers. We have to attend to them in the best way that we can. If someone is on third cycle, I don't know what they mean, because you can have, the initial phase of treatment where they say, okay, you've been treated and you didn't achieve response. And then they try another line of treatment. And then they say third line treatment. Most times when you advance in the lines of treatment, you go into more expensive medicines, and also medicines sometimes that have more toxicities. So if it's a third line of treatment, it could be one of those medicines that are not part of the background medicines.
Okay. Then you have John here. He says, spell out the said free services. I'm coming from a background where I not only paid for radiotherapy, but was even bounced repeatedly on several appointments for 2 months till God called my auntie. This is John, he didn't say from where.
Okay.
Yes.
Well, again, I wanted to add something on this. Our services, like radiation, people contribute some amount to receive the treatment. But we have a provision, those who cannot afford, they can be given a partial waiver by the executive office, and to get a waiver, you have to go through the social system. We have social services people who are going to assess and see that actually you can't afford. And when they say treatment for radiation, it's not even a quarter of the usual cost for radiotherapy. And this treatment, the contribution is to ensure continuity of services. If you are to do the actual costing, and actually we are carrying out a study to look at the actual costing of services at the Uganda Cancer Institute, it is going to surprise you that this amount that you contribute is quite small compared to the usual amount of money that one pays for if they are to get private radiotherapy services. And also, the time of waiting. When someone is going to receive radiation treatment, it's not a walk-in, that because Dungu has referred me for radiation, I'll go there, I talk to Dr. Lutu and say, now I've come for radiation. Radiation is a planned treatment. Remember, you cannot be exposed to all these rays without getting problems. So they do it in a way that they will understand the diagnosis. They will do what we call a planning CT scan to really tell where that disease is. And then they configure that using experts in physics, using experts in radiation, using experts in a number of things to get what is on the other machine, do conformity to make sure that now we are going to pass our rays to where the tumor is without causing trouble. Okay? Back in the years, they were using what they call 2D planning, and using the cobalt machines, and people would get terrible side effects. These days, our experts are able to use more than that. They look at a tumor from all directions, what we call 3D, and they're able to say, we shall pass rays here, and rays here, using the advanced system that we have. And a person receives radiation, and they get almost no side effects. So that process takes time. When you have an emergency, you can get emergency radiation. But when you have radiation that is intended to treat, to cure the disease, they plan it properly so that it's given in short fractions over a period of time. So if you look at the actual costing of that and the contribution that our people are asked to make, it's actually very, very small. I know some people can't afford, and those who can't afford, we are always getting them waivers to make sure that they can afford. Unfortunately, it's those who have money that sometimes ask for waivers. Those who can afford.
And that's what the waivers.
Yes. And then our other people, they continue to contribute and get the service. But that's okay. The issue is treatment is accessible, treatment is affordable, and even for those who can't afford, they'll get the treatment.
Okay then. Good morning, UBC. This is Gaddafi from South Sudan. I appreciate this show and I thank you for the help. This also will help us from where we are to be able to improve. He says good morning.
Thank you.
Now, then, thank you for the show. I have pain in the upper abdomen now 2 months. I've done several scans, but they don't show anything. I have been given ulcers treatment, but still pain persists. So, so you can imagine, okay? Doctor, truly the cancer services, that one still was saying the same thing, where they feel free. Yes. Thank you for the show. This is a person from Busia. I've been having asthma. I don't know if they want to relate it to cancer, but I think asthma, okay, for them it's as long as I feel a sharp pain in my lower back, in my lower intestines. Sometimes it is a stinging pain. Lower back pain could be a sign of cancer. This is Jordan from Luzira.
Yeah, there are people who have quite a number of symptoms, but don't think that whatever symptom you have is cancer. Because we are talking about cancer, it doesn't mean that whatever you have is cancer. I've actually seen quite a number of patients who are referred in thinking that they have cancer, and when you tell them that actually what you have is not cancer, they fail to believe it. There are so many other diseases, and there have been diseases even before cancer we got to know about it. So don't fear to go to hospital because you think they may tell you have cancer. Go to hospital so that they can find out what the problem is and then to see what intervention can be given to you.
Okay. So doctor, you have a long way as UCI to really convince the lay person that treatment is actually for free. Because you see, when he says the mom used to come there for chemotherapy and she used to pay every time she went till she died. So treatment isn't free. However, the services were good.
Thank you.
That is winning.
I will insist, cancer treatment is not free. Cancer treatment is expensive, but treatment is paid for by government, unless if such a service is not available. Okay? If you are asked to pay for a certain thing, it's a contribution, and it's actually recognized by government as part of the non-tax revenue, which is supposed to help with service delivery, and it's approved by the board, the parliament, and all these prices that you see are approved by parliament through the board.
Okay. Then good morning, I'm Megan from Kawempe. My daughter has some hard things on one side of her breast. She's 8 years old. Could that be cancer?
Highly unlikely that it is cancer. But again, as I said, take your daughter to a pediatrician to have them evaluated. But it's highly unlikely that it's breast cancer. It could be something else. Maybe what you think, because an 8-year-old may not have a big breast, it could be a lymph node somewhere, and you don't know. Until when a doctor evaluates, then they'll tell us what it is.
Okay. My mom has difficulty in breathing, swallowing, sharp pain, and sometimes talking is hard, and starts having productive cough from nowhere. Please, some advice. This is Teddy from Lira.
They have difficulty in breathing and sometimes coughing. I wonder if they could be having like an allergic lung disease, such as asthma, or anything else. To be honest, I cannot tell until when we have a chance to evaluate such a person. But I always want to encourage people, if you're not feeling well, seek for advice. Go and get to see a doctor to evaluate you, and then they'll give you guidance.
Okay. Then, now this one, some of them will ask, sorry, pardon, doctor, some will ask questions that might not be in your specific, but you could advise. Good morning, doctor. This is Praise from Kasubi. My big sister has been suffering from chest pain, and she says whenever she's breathing, it's cold, it's very cold air. And when she went to hospital, they told her that she has an enlarged vein in the heart. But she's been given medication, but there is no change.
I hope she's seeing, you know, when you talk about something that is about the heart, it's important to see a physician who has specialized in the area of heart diseases, or what we call cardiology. But it's good to start with a normal doctor, or we call a physician. Usually a physician in our setting is a doctor who has specialized in what we call internal medicine, medicine for adults that does not involve surgery. So if you see such a person, they can evaluate you. And also many times, you know, if someone says, I breathe cold air, it's quite unusual. Usually the air that you breathe out tends to be warmer than the one that goes in. But there could be other reasons why people feel like that. I've seen a number of people with, you know, worries, fears, and anxiety who tend to get such a feeling. You feel like something is in your chest. Yeah, they used to call it what? You feel like there's a ball sitting in your chest. When actually it's kind of stress or anxiety. It's good to see a person to evaluate and give them the right story. Don't hide things. If you don't find a person who can probe, they can miss on it and they say, maybe you have ulcers, when actually it's something different. Sometimes it's good to probe, because me as a patient, I may just say, doctor, I feel I can't breathe. And then it's you to find out what is it that you mean that you can't breathe.
Exactly.
You evaluate them. If you realize that, like after taking history, you listen to the chest, everything seems to be good, then say, maybe you don't have what you think you have. Tell me more about this and that. And eventually something will pop, and you understand what the challenge is.
Okay. Now this is for a lighter, now we go a little bit lighter and laugh about this. Jennifer from Luzira Bina, my husband has spent 1 year almost looking for herbs to enlarge his penis. Now, that brings in the question. That brings in the question of, like, some people have resorted to herbs vis-a-vis the cancer treatment, and they believe it is cheap. Some even will tell you, I have this specific herbalist who helped me to treat my person from cancer. Kindly help us demystify that.
We cannot deny that most people will seek for alternative remedies, even before they come in for what we call conventional treatment. Using herbs is not a crime. It is when you use falsified herbs that becomes criminal. If you take advantage of a person with a life-threatening condition and you tell them that what I have can cure your disease in a few days, and then they don't, to me I think if we are to use herbs the way they are, because you know there are so many medicinal herbs that can be used. But remember, we have one disease called cancer, but unique stories, okay? Not all cancers will respond to one medicine. So if you have a herb, or if you're using herbs and you say, these herbs treat cancer, which cancer do they treat? If we are able to specify and say, when you take this herb, it can cure leukemia, and maybe it does it like this. If you take this herb, it can do this and that. That becomes easier. But if you have one big syringe that can cure every disease, now we have moved away from that. We are now more specific. We are now, we know that because of the uniqueness of the disease, we treat them accordingly. The person-centered approach to cancer treatment. So if you are using herbs, keep that in mind, that gone are the days that we treat anything using one sweeping broom. No, no, no. We are now more specific. We use target treatment these days. Okay? So about penile enlargement, of course I'm not an expert in that, but we have to be careful on how we use those. Okay? Someone might give you a herb that is like Camus. If you apply Camus, you get a lot of irritation and swelling, and of course your penile organ will get enlarged because of swelling. But I'm just joking, don't go for that.
Okay. Then good morning, UBC TV, the doctor in studio. But now, what's the plan for government to regionalize cancer hospitals in order to avoid congestion and unnecessary demands by the doctors? This is JB from Mulago Market Zone.
Okay. In the beginning, I talked about our strategy of reaching out to the regions, and government is supporting these efforts to see that we can reach out to the people wherever they are. It may not be as easy because of the super specialization of the kind of intervention that we use, that we are in all regional hospitals. But at least we should have regional hubs for cancer treatment. As I said, we have a hub in Arua, we have in Gulu for the northern Uganda region, we have in Mbale, we have for Mbarara, we have here at the center, and also we have private facilities like in Zambia Hospital, which also comes in to support our works in cancer treatment. We can't forget their efforts. You've heard about the Rotary Cancer Runs, trying to decongest the current system by them putting up another service. So it's something that is recognized as a way of regionalizing cancer treatment.
Okay. Now, there was this person, sorry, they didn't say who they were, who talked about, she asked a question about, I think, lower abdominal pain, now 2 months, has done several scans, but they don't show anything, and has been given ulcers treatment, but she says she's not been advised on a way forward. Should she go for surgery or endoscopy to establish the pain in the upper abdomen?
I actually tried to respond to that, and I said, sometimes I combine two questions. When you have discomfort that has not improved, when they say you have ulcers today, tomorrow, and the other day, and then you get other issues, you need to be evaluated. Keep in mind that some people with allergic problems, including allergy to food, there's what we call irritable bowel syndrome, that might present with a feeling of discomfort in the abdomen. When you take milk, you get bloated, then you get episodes of diarrhea, then sometimes constipation. Those can happen. And a person with IBS or irritable bowel syndrome might come to hospital and you ask them, which medicine have you not taken? Because they've been on all forms of anti-ulcer medicines. They've been on all forms of investigations they've undergone, including colonoscopy, upper GI endoscopy, until when someone is able to take a sample and they do other tests to ascertain that actually they have irritable bowel syndrome. They might be in hospital all the time. How do you find out you have that? Go see your doctor again, tell them the story properly, rather than shopping around. Because we have a tendency of saying, I saw doing the other day, now let me try this. It's better the primary doctor refers you to another person who is going to take a proper history and tell you, okay, you've gone through A, B, C, D. My repeating of this will not add anything. Let's just understand that you may have A, B, C, D. And we can do some tests that will help confirm that what you have is this condition. But for you, please go and get seen again. If you've not been seen by maybe another expert, you can be seen. They take a re-evaluation and then come up with a plan.
Okay. Now, this is Brian from Arua City. Thanks for the program, doctor. I would like you to advise, because I've been having high blood pressure, which later affected both my kidneys, but still the BP remains up and I still feel a lot of pain around my heart. Sorry about that, Brian.
Yeah, indeed, sorry about that. High blood pressure, if it's not controlled, can lead to kidney problems. It can lead to, other end organ issues like the brain, the heart, and the eyes. That's why we say if you've been diagnosed with high blood pressure or hypertension, please be treated properly. If you're not treated properly, you end up getting complications, including kidney failure. And when the kidneys fail, unless you get a spare part, it becomes difficult, okay? So if you say it's not well controlled and you're in Arua, I think we have, he said in Arua, right? We have physicians in those areas that can see you. If they need to refer you, then they will need to refer you. But our point here is, if you don't know whether you have high blood pressure, if you've never had anyone examine you to see if you have hypertension, please go to a nearby facility. It takes less than 10 minutes to know if your pressure is normal or abnormal. If they find it to be abnormal, please ask for how it can be controlled. And they help you to have it controlled, because uncontrolled blood pressure, high blood pressure, will lead to further damage. We call it a silent killer because it doesn't have any symptoms. It's not like when you have hypertension, you feel like this. By the time you get symptoms, it's advanced.
Then what about the fact that he's saying his kidneys have also been affected?
This is what I'm saying, that the pressure, when it's not controlled, it will affect the target organs, including the kidneys. And the kidneys will fail.
That's why he's having the problem.
That's why, yeah, I assume. Because the failure will be told to you by the doctor that you are presenting like this because the kidneys are not working. However, primary kidney disease can also lead to high blood pressure because these work together. If for some reason you got kidney disease that hasn't been treated properly, then you end up getting high blood pressure.
Yeah, true.
So it can be a vicious cycle.
Yeah, true. Then you have this one. Good morning. I've been having ulcers since childhood because I recall when I was young, my mother used to give me tablets for ulcers. They even stopped me from taking cooking oil. But after my mother passed away, I started a new life. I started eating everything. But what I can say right now, I feel pain in the chest and backbone. Eating after 30 minutes. If I don't eat, I feel like vomiting. And I feel pain in my chest. I feel as if there is a wound, and I am taking treatment. Pain stops, and again it comes back. I even failed to go to the toilet because of the wounds down. And these wounds, they each, and that's what she says. And she says, I am told that it could be ulcers cancer. Kindly guide. Because the wounds are on.
I don't know how old the person is now, but if you've been unwell since childhood, first of all, you could be having some kind of allergy to the kind of foods you've been eating. There are so many children who are allergic to milk. There are so many people who are allergic to wheat products. And when they take certain things, they get problems. So if something started as a child and you continue, you know, one of them is irritable bowel syndrome. It can also manifest like that. But I don't know how old this person is now. They should be seen. They should be evaluated and given. Stop hiding into having ulcers. I don't know when I'll stop saying this. Not all abdominal discomfort is ulcer. And I see many people say, me, I have ulcers. As you know, when you ask them, do you have any serious illnesses in the past? They say, no, apart from ulcer. Then they say, what is ulcer? Okay? So when people have abdominal discomfort, they attribute it to having ulcers. But for us, we're talking about peptic ulcers. And the doctor will make a diagnosis. The other thing is, if they've done, you know, a blood test and they say you have Helicobacter, it doesn't mean that you have ulcers. Because they said, oh, I did a blood test, and they said I have ulcers. No. That blood test is to see if you've been exposed to an organism called Helicobacter pylorus, which is known to make peptic ulcers worse, okay? But don't say because you have that, you have ulcers, okay? You need to be evaluated properly and given the right interventions.
True. Then this one says, good morning. I appreciate the team at Uganda Cancer Institute. They do recommendable work. I have sent 5 cases, and so far 2 have passed away after getting services for 7 years.
Wow.
I want to appreciate Dr. Walu Sansa, who is taking care of my relatives. I always send them to her when they have issues related to cancer. And he says, doctor, keep it up.
Well, thank you so much for appreciating. As I told you earlier, there are those who have good, you know, experience, and there are those who have faced challenges. But we want, in the end, for everyone to have good experience when they're undergoing, you know, cancer treatment or any other challenges of life. Because health-related suffering is for real, and you can never tell who is going to have what.
Yeah, true. Okay, doctor, what are your parting shots to a person watching you right now?
Well, thank you so much all for watching in to UBC. And thank you, Sophie, for inviting me to talk about this rarely talked about condition called cancer, and especially in the format of open to all, ask anything you want about cancer. I'll sum it up by saying that we are all unique but united. You know, united by unique is a theme which has a lot of meaning, that if someone has cancer out there, cancer is one uniting factor, but they're unique people. The treatments are unique, the stories are unique, the challenges we faced are unique, but we are all united by the fact that it is cancer. And doing this, we are able to address and be able to bring down the burden of cancer, and also to help improve cancer management in this country.
Okay. Thank you so much, Dr. Dung. We do really appreciate. And thank you so much for those who have fully participated in the show right from the beginning up to this hour. Believe me, there is progress being made, you know, at the Uganda Cancer Institute. The demand is growing bigger. They have not sat back and said it's only this. Now with the regional hubs, that is very positive. Government is doing a good job. But also through a lot while taking care of these patients, but you're not alone. I would like to thank the team at Uganda Cancer Institute. You can imagine the ratio of maybe nurse to patient, doctor to patient, with 8,000 cases, new cases. Now we're not talking about only the old, but the new cases. That is as per last year. The number is quite alarming. I think we need to sit down and reflect on some of these things and see how we can change our lifestyles, and also be able to learn how to get diagnosis a lot earlier and not wait for cancer to get to the advanced stages. Thank you so much. Keep watching UBC TV. We do really appreciate you. And bye-bye. Catch you next week, same time.
Welcome to Chirudu National Referral Hospital, and this is our ICU. Our ICU was developed and started in 2021 in response to the COVID-19 epidemic, and we started originally with 3 beds. We started as a 3-bed ICU, but as we could not fulfill the needs for the entire hospital and for the country, the ICU was expanded to accommodate approximately 9 beds. We usually manage patients who have respiratory failure. That's patients who are unable to breathe on their own. We're able to place them on our machines known as the ventilators, and we're able to give them support. We're also able to give critical patients critical care in terms of advanced life support and such. We also receive patients from around the country who have a number of issues such as kidney issues, who we are able to help with dialysis and other support as well. Currently we have a capacity of 9 beds. We do try to improve, and we do try to build our capacity to have more patients.
Exercise can't be sustained. Eating can't be stopped. It's even harder to lose weight